So this is the 11th Biennial Conference of hardship. What are some of the key highlights on the agenda?
Well, the agenda, obviously the goal of the conference is to learn from how are we advancing universal healthcare and what is the role of faith-based organizations. Obviously, it is looking at how do we take policy into practice, how do we address health equity issues, supply chain issues, and build resilient health systems. But most importantly, also looking at localization and how do you work with local partners, strengthen their capacity, and equip them to address universal health coverage for all.
So what does universal health coverage looks like for a person who lives in low and middle income country versus someone in the developed country?
Well, it means that everybody has access to healthcare wherever they are, irrespective of their state they live in, for which it means there is equitable healthcare. And the out-of-pocket expenses that burden almost all families are addressed through equitable means, and everybody can have equitable access to healthcare. It also means that people who live in the most fragile context, unreached, and those who are missed have access to healthcare, where health is a universal right, and where you live and your geography or the context you live in is not a barrier for you to access healthcare. That means that there needs to be improved quality of healthcare, access to healthcare, and they can prevent illnesses. So it is a universal concept that reaches the unreached.
And Dr. Cherian, how would you describe the contribution of the faith-based sector on the journey towards universal health coverage?
Faith-based organizations offer a lot in terms of healthcare. For example, we did a survey across Africa and looked at 22 countries. And we found that roughly 9,000 healthcare facilities are operated by faith-based organizations. In some cases, as large as 50% of healthcare services offered by faith-based organizations. They include referral hospitals, clinics, pharmacies, teaching hospitals, etc. So their role in terms of offering patient-centered or client-centered healthcare is very critical. Not more. Also equally important is the compassionate care that is most critical if we are to achieve universal health coverage. But also, as you know, faith-based organizations operate in the most hard-to-reach context where the workers are committed to what they do, and they often live in security in insecure areas. So the contributions of faith-based organizations are unquestionable, especially in terms of ensuring equitable access to healthcare and healthcare that is respectful.
Briefly, how does primary healthcare, which is so essential, contribute to the big picture of universal health coverage?
The World Health Organization states that universal health basics or the foundations of healthcare. And so investing in primary healthcare is the most important and the most optimal and the best investment, which ensures that there is equitable access to healthcare, that demand-side barriers are addressed, and there is a multi-sectoral approach, which means we are looking beyond health, looking at other sectors and partnerships that are important to advance universal health.